Welcome to the holiday edition of Dr. Twyman's Ask Me Anything on Monday nights. This is live from my new studio audience at Apollo Cardiology here. So I'll give you a quick tour of it in a second. Let's see if I can just flip the camera around here. So, relatively messy at the moment, but you can kind of see that getting stuff set up, got some lighting, got some different backdrops, purple, which is our color for Apollo Cardiology, purple and red for UV and red light. And then you can see that I got some other cameras, some fancy lights, and a whole bunch of other gear to set up at some point. So just practicing tonight from the new space at Apollo Cardiology. So happy holidays. Got the holiday sweater. The ladies asked me to dress up in something today for all my telemedicine visits, so I got my Fragile sweater on here. So hope you guys are having a good night so far, and I'll hopefully entertain and answer some questions for you. So, all right, so first question up tonight, the grounding sheets for sleep. Any recommendations? Gets a little complicated. Yes, it is optimal to be grounded, but it is not optimal to plug the sheets into the AC power grid. So if you're going to get the grounding sheets, ideally go to your local hardware store, get some copper wire, wrap it around the grounding plug of the sheet, run that wire out your window or door, put it into a copper plug, and drive it into the ground. You can do that for under 15 bucks add-on. So if you're really going to ground, actually ground to the ground, not into your AC power grid. Otherwise, it's like being a piece of meat and you're in a microwave, potentially dehydrating yourself. There may be jump conduction, so we didn't want to do that. Next question of tonight. Initial blood pressure when sitting, systolic blood pressure 130 to 40 millimeters of mercury. After a few, looks like trials or sitting down for a bit, blood pressure drops to 120. Any issues? Not generally, that's pretty normal. You don't want to check your blood pressure immediately upon sitting or standing because there's going to be a shift. So you usually want a kind of a 5-minute warm-up period into it. So typically blood pressure is best, feet on the ground, back supported, arm at heart level, bicep cuff, check blood pressure. Guidelines say you should repeat it every 3 to 5 minutes and average them out. Nobody's actually going to do that. So at least give yourself 5 minutes before you check a blood pressure and say that's your true blood pressure. So unless you're symptomatic, I wouldn't worry about the blood pressure shifting around a little bit. All right. So see Dr. Scherer here. So happy holidays to you as well. All right. So Phoenix to St. Louis. All right. So that's about a 2.5 to 3 hour flight. When should I wake upon arrival? So don't know if you mean you're coming to visit me in St. Louis, possibly. If that's the case, personally, if you're only in St. Louis for 2 or 3 days, stay on Phoenix time. Set your watch to that time and live by that time. Melatonin, would not take melatonin for such a short trip. Typically, I'm thinking about like 4 or 5 time zones before I'm considering melatonin. 2 time zones, I just stick with it. So it's recently just in Las Vegas, going that way. So mostly try to stay in St. Louis time when I was there. So best recommendations, just get up when the sun rises. Right now in St. Louis, about 7:15 a.m. And stay up. And then, when it's dark, wear your glasses. All right. LMNT, or a salty hydration drink, what are the real effects on blood pressure? It's variable. The glycocalyx, that's a protective gel coat that lines your arteries. One of its job is to sequester sodium. So the LMNT has 2 grams of sodium. Some people are salt sensitive. In that case, it may raise their blood pressure. When you hold on to salt, you hold on to water, the water volume expands the arteries expand, blood pressure goes up. It affects the renin-angiotensin system. So you have to kind of play around with it to see, is it affecting your blood pressure? The guidelines that everybody needs to be low sodium or too aggressive, and the 2 grams, that's probably too low for somebody who's relatively healthy, probably around 5 to 6 grams a day for some people, and there's still normal blood pressure. All right, what are my thoughts on cryotherapy for cold exposure? I've done it many times. It's interesting, looks really cool for the gram, see the smoke rising up, but from a kind of metabolic standpoint or a lasting health effect, it's mostly for show. It does not penetrate deep enough. The core temperatures don't tend to drop, so much more benefit from cold exposure in water. The optimal would be actually on metal. That's what cool sculpting is, what the plastic surgeons do to freeze fat cells, but people would actually injure themselves or kill themselves at home if they were using cold via steel plates. So cold water immersion, equal distribution is probably preferred. Cold showers, done many of them. It's very good mental, strengthening benefits to do a cold shower, but it's unequal administration. So some areas are cold, some areas are warm. Honestly, cold showers suck way worse than cold baths. And this is kind of somebody who last year swam in the Arctic Ocean and thought it was, not that cold after you got used to it. And when you came out of it, felt warm. So I would definitely prefer a cold plunge versus a cold shower. Cryo, chambers, you can do them, but not a lot of long-term benefits, I don't believe. All right, a 62-year-old female, no hormone replacement therapy, had pain with statins. They were on the generic Crestor, which is rosuvastatin, and they had myopathy, so muscle pains in their legs. They're asking for help. So depends on why you were started on the Crestor. If you have known vascular disease, you've had a heart attack, stroke, you have a stent, you've had bypass surgery. If you can't tolerate one statin, it doesn't mean you can't tolerate them all. The goal is to stabilize the plaque, lower inflammation, and treat the lipoproteins. So if you can't tolerate Crestor every day, sometimes 5 milligrams twice a week, switch to pravastatin. Those are usually the starting points. Can't tolerate any statin, then the PCSK9 inhibitors, ezetimibe, or the new kid on the block, Nexletol. Those are the other 3 classes of medicines that have outcome data that people have less cardiovascular events when they have their lipids modulated with it. But quick side note, if you have muscle symptoms on statins, make sure you're not vitamin D deficient, your CoQ10 levels are not low, you're not hypothyroid, and do you have an ApoE4 allele? If you have an ApoE4 allele, you may not tolerate any of the statins at high doses. Next question up tonight is, looks like some type of hydroxyapatite in a toothpaste harmful for cardiovascular health. No, it should actually be beneficial. You want to avoid fluoride in your toothpaste. Fluoride's a neurotoxin, a thyrotoxin, affects the oral microbiome, thus may affect the way your body produces nitric oxide. It's what's known in physics as a dielectric blocker, so it limits the amount of energy that the water in your body can store. So fluoride's some nasty stuff, so try to avoid it when possible. Hydroxyapatite is very good for the teeth, so should be at least neutral for the cardiovascular system. Question about high ApoB. Looks like they also have lipoprotein A and a elevated calcium score test. They went on a plant-based diet and the blood markers went up. Why? Help, all right? So that's what we do here at Apollo Cardiology, is we help people get to the root cause of their cardiovascular concerns. So always look at what volume of plaque you have first. If your calcium score is over 400, that's a high-risk finding. If you're over 1,000, that's a very high-risk finding. So treat the plaque. How much effect does diet have on lipids? It's completely variable, but if you went on a plant-based diet, would be concerned that you have an issue with reabsorbing sterols in your gut. So maybe ezetimibe would be an option. The Boston Heart Lab panel would be a good way to go. Would tell you if you're a hyperproducer or hyperabsorber of sterols. Often we will use the GB Insight panel. Looks at about 120 different genes that affect your lipids. That gives you a better idea of which medications or supplements or lifestyle interventions are likely to work best for you. Person says that they eat right, they exercise, they have low inflammatory markers, low triglycerides, but high LDL ApoB. Any concerns? So see this every single day in the practice. So one variable usually isn't the problem. Always want to look at what is going on with the arteries. So how healthy is your endothelium and the underlying intima? So we do a test called the endopat, tells us how much nitric oxide your arteries can release and dilate them. We look at blood pressure, both your brachial and central pressure. What is the blood pressure as it comes out of your heart? We look at arterial elasticity with a device that measures pulse wave velocity. How stiff are your arteries? If your arteries are stiff, you have inflammation building up in your carotid intimal thickening scans, or the intima itself is thickened, then you're more concerned about the quote elevated LDL particles in ApoB. If you don't have a calcium score that's above 0, your sanctity is normal, you have normal endopat scans, maybe you just continue to work with lifestyle interventions. If you're interested in trying supplements to lower lipids, I'm not necessarily opposed to it, but show me you have a calcium score of 0 and be more open to it. But supplements, they may have their role, but if they're going to work, they got to work within like 90 days or more, less. If they're not working in 90 days, they're probably not going to work, and you probably should consider pharmaceutical agents if you're in a higher risk category. And the higher risk is people who have endothelial dysfunction and plaque in their arteries. Will Plavix and or baby aspirin make the kidney blood test fail? The short answer is probably not. If you're only taking 81 milligrams of aspirin, which is a non-steroidal, if you're taking high doses of aspirin, there is possibility it could cause some kidney impairment. Clopidogrel in and of itself should not, but when you say it's causing kidneys to fail, is that just a creatinine number? That's very sensitive to your muscle mass. So I'd want to see that you have an elevated cystatin C. There's a new test called SDMA, symmetric dimethylarginine. If that's elevated as well, then that correlates that the kidneys are potentially failing. All right. Are there any non-invasive ways to remove plaque from my carotid arteries? I actually have about a 40% blockage in the upper part of my right carotid. I'll be doing chelation. All right, so it is possible to lower plaque in the arteries. I've seen it in multiple patients. You first have to figure out what's causing the glycocalyx disruption and endothelial dysfunction. Remove that so you're not continuing to lay down plaque. Got to keep oxidative stress and inflammation low. You can monitor blood tests to make sure that that's happening. And then use whatever combination of lipid-lowering therapies you need that generally remain less than the 20th percentile. So in that case, I'd want to see ApoB at least less than 70, but optimally 55. Chelation therapy, is it useful? In some instances, but typically it's really only in diabetics and or people who have ongoing heavy metal exposures. There was a trial called the TACT trial that had shown that. They repeated it, called the TACT-2, T-A-C-T-2 trial, came out in April of this year. The clinical trial results were presented at the American College of Cardiology annual meeting down in Atlanta in April, and I was in attendance. So I was in the audience when they released the results of the test, and the results are what was known as negative or neutral. There is no benefit to chelation in the greatest majority of people. So if you don't get a benefit, it's not worth having your IVs multiple times a week to get it done. If you're diabetic and you have chronic exposure to heavy metals, different story. There are other things that we talk about with my patients after I know their full story, but there are different things that can support the glycocalyx that have been shown to get soft lipid cores in the soft plaques in the carotid artery to shrink up to 40% in 6 months. So if you're interested in that, you can talk to my team at drtwyman.com. I have an application if you're interested in working with us directly to get to that root cause, and if you want to know about our current cocktail to help regress plaque, talk to my team about that. All right, so this was a follow-up to the Plavix and aspirin question. So it looks like it's just a creatinine. So I'd want to know how much lean muscle mass you have, but you should have a cystatin C as well as a SDMA potentially, but particularly that's the cystatin C. The albumin creatinine ratio being 15, you generally want it at least less than 30. Somebody says that they're saying, I think it's the person who talked about the carotid plaque, that I assume this means arterosil. If you're taking arterosil, that is the supplement that supports the glycocalyx. Does having plaque mean endothelial dysfunction? Great question. So how do you get plaque in your arteries? It starts with endothelial dysfunction. So you have nearly 60,000 miles of blood vessels. Lining the blood vessels is a layer called the endothelium. It's one cell thick. And think of it as a protective coating. On top of that is the glycocalyx, a protective gel coating that protects the endothelium. The gel coat gets damaged and the underlying endothelium gets damaged. The body doesn't release sufficient nitric oxide to prevent the white blood cells, the cholesterol particles, from sticking to the arteries and kicking off the cascade that ultimately leads to the plaque formation. So if you have plaque in your arteries, at some point you had endothelial dysfunction, but do you still have it? That is key. I saw somebody today who had significantly high plaque in their arteries, but they don't have endothelial dysfunction now. So they've kind of fixed the problem. So that plaque seems to be more old plaque. So there are tests that can be done to look for both. We look for the plaque in your carotid, your coronaries, your abdominal aorta, your femoral arteries. Plaque is, systemic. It's usually in more than one territory. Not always, but you need to go looking for it in multiple territories. Because if you have a normal carotid, there's no guarantee that you have a normal coronary scan. But if you have plaque, then you want to know, have you fixed the problem that caused it? So that's where the EndoPAT test can look for, do you have endothelial dysfunction? Pulse wave velocity indirectly looks at that. All right. So I see a couple of familiar faces on here. And I think I got to the final pre-submitted question. So if anybody has anything else they want to share, I'll answer for you. Otherwise, I'll pop off early here tonight for you guys, let you enjoy the holiday week. I'm Apollo Cardiology. We saw some patients today, but we'll be out of the office until Friday. I'll be checking my messages, so if you're one of my patients watching, I'll be available if you need us. But back to office Friday morning. Monday, 6 p.m. Central Time. Going to keep doing these IG Lives for the foreseeable future. I showed some people earlier that we're in our new space. I have a space next door, which I'm still in the process of setting it all up. Let's see if this goes here. So a lot of gear that still needs to be all set up. I got the green screen, a bunch of other lighting, got some different tone backdrops, and then I have some more cameras, big fancy light, and then a bunch of light stands. So this is the project I got over the next few weeks to get all squared away. So Merry Christmas, Happy Holidays to all of those as well that are wishing me here. And hope you guys have a great week. I'll see you guys next Monday.